If your socks are leaving marks on your ankles by the end of the day, most people assume it is nothing. Just getting older. Maybe the heat, maybe you were on your feet too long. But here is what most seniors are never told. In some cases, that swelling is your body trying to send a message. And if you are over 60, there are 6 specific clues that can tell you whether that swelling is something harmless or something worth bringing to your doctor immediately. One of these 6 clues surprises almost everyone, and it is not the one you would expect. My name is Grace Wells. I am a kidney and diabetes health educator for older adults, and I want to be honest with you from the very start of this video. Swollen ankles do not always mean something is seriously wrong. There are many reasons ankles swell. Some are completely harmless, but some are your kidneys, your heart, or your fluid balance trying to get your attention. And after 60, the difference matters. So today we are going to walk through 6 specific signs that tell you this is more than just tired legs. I want you to know what to watch for, what to write down, and what to actually say to your doctor at your next visit. And I will tell you right now, the last clue on this list is one that most people completely overlook. Even some doctors do not ask about it unless you bring it up. So stay with me through to the end. This is worth your full attention. Let's start with something that happens in almost every home, every evening, and almost no one takes seriously. You sit down after dinner, you take off your shoes, and you notice the elastic from your sock has left a visible mark around your ankle. Maybe a little indentation in the skin. You press the area and it takes a moment to come back. That is called pitting edema. And while it can happen for simple reasons, like standing for hours or sitting on a long car ride, when it happens regularly without a clear reason, it is worth paying attention to. Here is why this matters for kidney health specifically. Your kidneys are responsible for filtering fluid and helping your body maintain the right balance of water and sodium. When the kidneys are not working at full efficiency, which becomes more common after 60, they may have trouble clearing excess fluid from the body. That fluid can pool in the lower legs and ankles because of gravity. Now, this alone does not mean your kidneys are failing, but it is one piece of a larger picture. And the sock mark clue is often the first thing people notice, weeks or even months before they connect it to anything medical. If you are noticing those sock marks most evenings, write that down. Note when it started, whether it is getting worse, and whether anything makes it better. That information will help your doctor understand what is happening. And if this is the kind of conversation you have been wishing someone would have with you honestly, please stay with this channel. I make these videos specifically for adults over 60 who deserve clear, calm information. Not alarm, not confusion. Now let's talk about something that can help you tell the difference between a minor circulation issue and something that needs medical attention. Look at both ankles, not just one. This sounds simple, but it is actually one of the most important things you can observe at home. When swelling happens in only one leg, that can suggest a local problem. A blood clot, a joint issue, an injury you may not have noticed. These are serious in their own way, but they are usually not kidney related. But when both ankles and feet swell at the same time, roughly equally, that pattern is more consistent with a systemic cause, something affecting the whole body. And in older adults, systemic swelling is often related to kidney function, heart function, or problems with fluid and sodium balance. Bilateral swelling, swelling on both sides, is one of the signals that tells doctors to dig deeper. It is not a diagnosis, but it changes the conversation. So the next time you notice swelling, take a moment. Look at both feet. Is it one side or both? That simple observation is genuinely useful information for your doctor. Now here is where many seniors stop thinking about swelling, because they think it only shows up in the legs. But there is another place fluid can collect, and if you have never connected this to your kidneys before, this may be the moment where the pieces start to fit together. Look in the mirror first thing tomorrow morning before you have been up and moving around for an hour. Look at the skin just under and around your eyes. Is there any puffiness there? Any slight fullness that was not there when you went to bed? This is called periorbital edema. And unlike ankle swelling, which gets worse through the day from gravity, eye swelling from fluid retention tends to show up in the morning, before gravity has had a chance to pull it downward. When the kidneys are not filtering properly, they can allow protein to leak into the urine. That protein loss changes the balance of fluid in the body, and fluid begins to move into places it should not, including the soft tissue around the eyes. Now, puffy eyes in the morning can have other causes: allergies, poor sleep, sinus congestion, salt-heavy food the night before. These are common and usually harmless, but if you are noticing eye puffiness that shows up regularly in the morning and it seems to come and go without a clear reason, and you are also noticing other signs on this list, that combination is worth mentioning to your doctor. It is not a reason to panic. It is a reason to pay attention. And speaking of paying attention to patterns, let's talk about something that many older adults track without even realizing it matters. Have you ever stepped on the scale and noticed you are suddenly 2 or 3 pounds heavier than you were a few days ago, without any obvious change in what you ate? That is not fat. Fat does not accumulate in 2 or 3 days. What accumulates that quickly is fluid. Rapid weight gain over just a few days, particularly 2 to 5 pounds or more, can indicate that your body is retaining water faster than it should. In someone with reduced kidney function, this can happen when the kidneys are struggling to clear excess fluid efficiently. This is why many cardiologists and nephrologists ask their patients to weigh themselves every morning at the same time before eating or drinking. Not to obsess over the number, but to catch a sudden shift before it becomes a bigger problem. If you are gaining 2 or more pounds within a day or two and you do not have an obvious explanation, that is a signal worth tracking and discussing. For seniors managing both kidney and heart conditions, this kind of fluid shift can be especially significant. Your doctor may have specific guidelines about what number to watch for and when to call. If you do not have that guidance yet, it is worth asking for it at your next visit. Now we are getting to the clues that move from worth watching to call your doctor sooner rather than later, because the next 2 on this list are ones I want you to take seriously. If you are experiencing swelling in your ankles or legs, and you are also noticing that you feel short of breath, especially when lying down or when doing something that used to feel easy, please do not wait on that combination. Swelling plus breathlessness is a signal that can suggest the heart and kidneys are both under strain. These 2 organs work very closely together. When one struggles, the other often follows. Fluid that backs up because of poor circulation or impaired kidney filtration can begin to affect the lungs. That is when breathing becomes harder. This is called cardiorenal syndrome in medical language, and it simply means the heart and kidneys are affecting each other. It is not rare in adults over 60, and it is something doctors need to know about quickly, not at a routine appointment 3 months from now. If you are experiencing ankle swelling with any degree of breathlessness, when lying flat at night, when walking across a room, or when doing stairs, please contact your doctor. This week, not next month. You do not need to be dramatic about it. You do not need to go directly to an emergency room for mild symptoms, but you do need to make that call because this is exactly the kind of thing that is much easier to manage when it is caught early. And now, the 6th clue, the one I mentioned at the beginning that most people overlook completely. I want you to think about something you probably do not pay much attention to on a daily basis: your urine. I know this is not a comfortable topic, but I am going to talk about it anyway because it is one of the most reliable windows into how your kidneys are actually functioning, and most seniors have never been told what to look for. Here are the specific changes that can matter. First, foamy or bubbly urine. Not just the normal little bit of foam from splashing, but persistent, thick foam that lingers in the toilet bowl after you flush. This can indicate that protein is leaking into the urine. Healthy kidneys are designed to keep protein in the bloodstream. When they are damaged or under stress, protein begins to escape. And one of the early visible signs of that is foamy urine. Second, color changes. Urine that is consistently darker than a pale yellow, or that looks brown, tea-colored, or cloudy, can suggest the kidneys are struggling or that there is something else going on that needs evaluation. Third, changes in how often you urinate, going much less frequently than usual, or waking up multiple times at night to urinate when that was not your pattern before. Both of these shifts can relate to how the kidneys are managing fluid overnight. None of these changes alone are a diagnosis, but any of these changes, especially when combined with ankle swelling, is something your doctor needs to know about. And here is the part that I think is genuinely important for you to hear. Many people are embarrassed to bring up urine changes at a doctor's appointment. They wonder if it is worth mentioning. They wonder if the doctor will brush it off. You have every right to bring it up. It is medically relevant. And if you pair it with what you have learned in this video, I have been noticing swelling in both ankles, some morning eye puffiness, and my urine has looked foamy for the past few weeks. That is a clear, organized description that any good doctor will take seriously. Your ability to describe your own symptoms clearly is one of the most powerful tools you have in a medical appointment. If this video is helping you build that kind of confidence, to go into your next doctor's visit prepared, not panicked, then please share it with someone you know who might need it too, because that is exactly why I make these videos. Now let's talk about what is actually causing all of this, and what questions you should be asking your doctor directly. When swelling becomes a pattern, not just once after a long day but regularly, it almost always relates to one or more of these four things: the kidneys, the heart, your medications, or your sodium intake, and after 60, it is often a combination. Here is something many people do not know. Dozens of commonly prescribed medications can cause or worsen ankle swelling. Calcium channel blockers, a class of medication often used for blood pressure, are one of the most well-known causes. Certain diabetes medications, steroids, some pain medications, NSAIDs like ibuprofen, which many seniors take regularly for joint pain, can affect both kidney function and fluid retention simultaneously. This does not mean you should stop any medication without guidance. Please do not do that. But it does mean that medication review is a legitimate and important conversation to have with your doctor or pharmacist, especially if the swelling started around the same time as a new prescription. And then there is sodium. This is where I want to be direct with you. Most Americans, and most older adults specifically, consume far more sodium than they realize. Not because they are adding salt at the table, but because of what is already in their food before they touch it. Canned soups, deli meats, bread, cottage cheese, canned vegetables, packaged seasonings, restaurant meals, fast food. These are where the sodium hides. And for seniors with any degree of reduced kidney function, excess sodium makes it harder for the kidneys to maintain fluid balance, which means more swelling. Your target sodium intake depends on your specific health situation. If your doctor has told you to limit sodium, the threshold they are likely referencing is somewhere around 1,500 to 2,300 milligrams per day. But if you have specific kidney disease, heart failure, or high blood pressure, your doctor may have given you a different target. The most important thing you can do right now is start reading the sodium content on nutrition labels. Look at one item in your pantry tonight, just one. You may be surprised by what you find. Now let's talk about what to actually do with everything in this video, because information alone is not enough. When you go to your next doctor's appointment, here are the 5 things worth asking about, depending on what you have been noticing. Ask about your kidney function. This is typically measured with a blood test that gives you something called an eGFR, estimated glomerular filtration rate. This number tells you how efficiently your kidneys are filtering. Many seniors have never been told their eGFR. Ask for it. Ask about urine protein. A simple urine test can check whether protein is leaking into the urine. If it is, that is early and important information. Ask about your blood pressure. High blood pressure is both a cause and a consequence of kidney strain. Managing it well protects the kidneys over time. Ask about heart function. If swelling is consistent, your doctor may want to check for signs of fluid backup related to the heart as well. And ask for a medication review. Bring your full list of medications, including supplements and over-the-counter items, and ask if any of them could be contributing to fluid retention. You do not need to ask all 5 in one visit, but having them written down and asking even 1 or 2 is more than most people do, and it gives your doctor the information they need to help you. Before we close, I want to give you something simple and practical you can actually use today. Starting tonight, write down what you notice. Is there sock mark swelling? Which side or both? Is it better or worse in the morning? Have you gained weight recently? Any changes in breathing, urination, or energy? A few sentences in a notebook or even on your phone. That record, kept for even 1 or 2 weeks, gives your doctor far more to work with than a vague sense of, I have been feeling off. And tomorrow morning, take 30 seconds at the mirror. Look at your eyes before you have been up for an hour. That one habit, done consistently for a week, can tell you something genuinely useful. A word before we close. Everything in this video is educational information. It is not a diagnosis, and it is not a replacement for the guidance of your own doctor. If you have kidney disease, heart disease, diabetes, high blood pressure, or if you are managing multiple medications, please speak with your care team before making changes to your diet or routine. Kidney and heart conditions are highly individual, and what applies to one person may not apply to another. I want to be clear, most ankle swelling in older adults has a manageable cause. This is not a reason to panic. It is a reason to pay attention, ask good questions, and take your own observations seriously. Now, Chantikar, I have one question for you, and I genuinely want to know your answer. Do you notice swelling more in the morning or more at night? Leave your answer in the comments below. It takes 10 seconds. And your answer may actually help another senior in this community understand their own pattern better. That is how real conversations help people. If one sentence in this video helped you feel more prepared for your next doctor's visit, then this video did exactly what it was meant to do. And if this is the kind of honest, clear kidney health guidance you wish someone had explained to you sooner, you may want to stay with this channel. I post regularly for adults over 60 who want real answers, not alarm. Take care of yourself, and I will see you in the next one.